necessarily those of this station, its staff, management, or sponsors. Welcome to your Hometown Health Show, brought to you by Trilogy Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
Good evening, everyone, and I'm Yolanda Santana, host of the show. It's your hometown healthcare, sponsored by Trilogy. And from Trilogy, we have Liza May, our home health coordinator. How are you, Liza?
I'm great. How are you, Yolanda?
I'm well. And if in case you're just tuning in, you can also listen to us on 1470 AM, 95.3 FM, 96.9 FM, and 103.9 FM, as well as AMP2.TV. So we are here to welcome our special guests, Dr. Chen and Dr. Bushkin, from 21st Century Oncology. I think they might be a little bit late. Do you have any word on them?
I think they are communicating with them at this time, trying to see if they can connect and be with us pretty soon.
All right. Well, then let's get started. Liza, if you would please tell our new listeners and viewers a little bit about Trilogy and what you guys do.
Well, Trilogy is a straight Medicare certified company. We are in the whole state of Florida except Miami and the Keys. So anywhere serving the counties of Broward all the way up to Jacksonville, all the way up to the Panhandle. We provide traditional home health services like nursing, physical therapy, occupational therapy. And aside from that, we also provide respiratory therapy, speech therapy, psychiatric nursing, and wound care, which is very important. I think it's something that the doctors might touch upon when they do connect at some point during this meeting.
Perfect. Yeah, I hope to jump on soon. So again, we're going to be welcoming Dr. Christopher Chen. He's a radiation oncologist, and Dr. Frederick Bushkin, breast surgical oncologist, both with 21st Century Oncology. Any moment now, hopefully.
Yeah, this is Dr. Chen. I'm here.
Oh, hi, doctor.
Hi, Dr. Chen.
Yes, we can hear you.
Okay, great.
We're so glad you're able to jump on. Why don't you tell our listeners a little bit about yourself and your practice at 21st Century?
Yeah, so I'm a radiation oncologist for 21st Century Oncology. I've been with this practice for almost 2 decades now. This practice is a multidisciplinary practice, so it involves radiation oncologists, medical oncologists, surgeons such as Dr. Bushkin, and in some parts of the country and some parts outside the country, cardiologists, amongst other specialties as well. GYN oncologist is one of those.
Great.
Go ahead.
Go ahead.
We have centers all around the United States, many of which are concentrated here in the east coast of Florida, spanning from Monroe County and Key West all the way up to Fort Pierce. And then there's a little break, and then Jacksonville as well.
It's great coverage. Is Dr. Bushkin with us?
I think he's dialing in at this time.
Okay. So, Dr. Chen, I understand 21st Century is also, and I think we had your colleagues on our show last time, but you're also now Genesis Care. With that being said, can you tell our listeners how centers you now have and what exactly that means for your patients? Can you hear me, Dr. Chen?
I can hear you.
Okay. Could you tell us, our listeners, a little bit about Genesis Care and what that means?
Yes, this is Dr. Frederick Bushkin. I'm a breast surgical oncologist with Genesis Care. Genesis Care is a company from Australia that also has offices and practices in the UK and Spain, and recently purchased 21st Century Oncology, which is a national group of cancer specialists. So it is now an international cancer conglomerate with leadership coming from Australia. And it's a very exciting time to be with that company. They've invested a great deal of capital, time, and expertise, and we're looking forward to tremendous growth in the United States.
We're so glad you're able to join us, Dr. Bushkin. Can you tell our listeners a little bit about yourself?
Yes, I'm a breast surgical oncologist, and the fact that it says surgeon, we're far more than just surgeons. We're fully trained, board-certified surgeons, but we're trained and have expertise and experience and knowledge in breast care. So a big part of our practice is consultation, seeing well women, genetic counseling and testing, high-risk lesions, and, of course, proceeding with surgery. But it's a very, very scientific specialty today. And women who have any breast problem whatsoever really need to see any of the men and women around the country that are breast surgeons.
Right. Is Dr. Chen still on with us?
I'm back. Yeah, I'm on. I'm back on.
Okay. Okay, great. Dr. Chen, can you give our listeners a little insight into the new technology that will be available to them right here in their backyard in your plantation office? I believe it's called a Variant Edge machine.
Yes, Genesis Care has really invested in bringing the best technology, the best equipment to all of our centers, starting with the plantation office. And the first machine that's going in this area, or is almost fully installed in this area, is called the Variant Edge. It's a linear accelerator and a stereotactic radiosurgery system. What it's able to do is really deliver pinpoint precise radiation treatments to all tumors of all sites, all throughout the body from head to toe. In addition, it's also able to perform something called stereotactic radiosurgery, or some people may know it as bloodless surgery or knifeless surgery, scalpel-less surgery, to really be able to hone in on the tumor yet minimize side effects to the surrounding normal tissues and organs. It's really one of the newest technologies, and it's complemented by the Vision RT image guidance surface-guided radiation therapy system to really improve the accuracy of the treatment. And also nowadays, with this new equipment and this new technology, we can now be completely tattoo-less. Many people may know that when you get radiation therapy, you need these small tattoos to help pinpoint the sites of disease, or help us pinpoint and aim the radiation. However, with this new equipment and the new technology that's being invested, that's no longer needed. This machine, again, is being installed right now in the plantation office, but it's soon going to be also in the Pembroke Pines office and spread to the other offices throughout the east coast of Florida. And it is right now the newest of the newest technology and the newest machine in South Florida at this time.
That's great. That's amazing. Now, can you also explain the importance of prostate screening to our listeners?
Prostate screening is critical. It's prostate cancer, as many of you guys may know, is the second leading cause of cancer in the United States, nearly 200,000 cases per year. And many of these cancers, if detected early enough, are easily curable. These 200,000 cancers frequently will result in 33,000 deaths per year, and many of these deaths may be able to be avoided with early detection. And this is really critical to emphasize that detection is nothing more than a simple blood test that you get at your primary care doctor's office, your annual physical once a year, as well as a rectal exam. And this is very critical, and it's fairly easy to detect early. Once your PSA is found to be elevated, or if your PSA is found to be elevated, or you have an abnormal rectal exam, then this will frequently prompt a biopsy of your prostate. It's not too difficult to diagnose and detect prostate cancer in an early stage if you just are a little proactive and you see your doctor on a regular basis.
All right. On that note, we're going to take a short break, and when we come back, we'll talk about breast cancer awareness. Stay tuned. You're listening to your Hometown Health Show. We'll be right back.
Trilogy was established in 2016 by industry experts with over 30 years in home health care operations spanning 30-plus counties throughout the state of Florida. With offices in Jacksonville, Port St. Lucie, West Palm Beach, we strive to provide the most optimal care to our patients in a fun, forward-thinking environment. Our focus is on personal relationships, whether with an employee, a patient, or an outside community. Because we know that when people enjoy what they do, it becomes why they do it. Call Trilogy today at 954-689-6660 and ask for more information. In addition to offering the standard mix of services, SN, PT, OT, speech, MSW, and HHA, we also take great pride in being on the cutting edge and offering care and education to our licensed clinicians in other areas most agencies likely don't offer. Emotional and behavioral health with our psych nursing, biofeedback for bladder incontinence and pelvic pain, chemotherapy, IV hydration, antibiotic and respiratory therapy. Call today at 954-689-6660. Trilogy Home Care. You have been listening to the Trilogy Home Health Show, and if you wish to be a guest on our show, please call us at 561-670-9213 and let us share your knowledge and information with our listeners. Trilogy Home Health Care Show enjoys serving the community and bringing doctors and facilities of interest to help educate and inform the community. Please call us at 561-670-9213 and let us put you on the airwaves with the Trilogy Home Health Show.
Welcome back, everyone. You are listening to your Hometown Health Show, and I'm Yolanda, your host. And we were going to get into breast cancer awareness with Dr. Bushkin. Dr. Bushkin, with Breast Cancer Awareness Month right around the corner, can you tell our listeners the importance of early screening?
Well, yes, I'd like to expand if I may. Certainly, that's very important for the month of October, because it makes available to certain people the ability to get breast imaging studies at a financial discount, which is very important. But it's important to note that a woman 40 and above should have a mammogram and an ultrasound. Having an ultrasound with the 3D tomosynthesis mammogram is very important. The other study is an MRI. Some women need it, some don't. But they're complementary studies. It's not like one is better than the other. But a woman could have a breast cancer not seen on a mammogram or not seen in an ultrasound and maybe not seen on MRI. So the breast physical examination, both by the patient and their doctor and in consultation with the breast surgeon, is extremely important. Some women get a false sense of security when they have an abnormal breast exam and they're told that the mammogram and or ultrasound is negative. So that's very, very important. We do get breast imaging in women that are younger for various reasons, based on family history, based on genetic testing. And then we have what's called a high-risk protocol. We have a group of women who, in addition to the mammogram and ultrasound, get yearly comparative MRIs. And one final point, there's so many facilities around women's centers and breast imaging studies. It's important that the woman, if she stays at the same center, has comparison year to year to year of the imaging, or if she goes to another center to take the disc and be sure that they upload it in the computer system and compare one to the other. That's extremely important.
That is really great advice. I had no idea. So what about the role of genetic counseling and testing in patients you see in your consultations?
Yes, I mean, I do this on a daily basis. So we as breast surgeons are maybe the first trained physicians that see the patients for both um, genetic counseling and testing. More and more of the gynecologists, when they take a history and they get the pedigree, meaning the family history, they may go ahead and take a specimen and send it to one of the very fine genetics labs. But it's extremely important. This began some years ago with the BRCA1 gene and then the BRCA2 gene in Ashkenazi Jewish women. And now, and I did this today on a daily basis, we do a multi-gene DNA panel that looks at 40 different genes. So it's not just breast cancer we look at, but we look at many other potential gene mutations. And just as a point, if a woman has the BRCA gene and does not have breast cancer, but has that gene, the risk of breast cancer for that woman lifelong is 75%, and the risk of fallopian tube and ovarian cancer is 50%. So I can tell you, how we care for those women if you wish, but just to let you know that that's a group of women. Now, other women, Latin women, African American women, Scandinavian women, any woman can have a gene mutation, be it BRCA or one of the other gene mutations. And also with the gene mutation, you can have high risk for other malignancies. So you need to see experts in the field, and that's part of our training and teaching and experience, genetic counseling and testing.
All right. Well, both doctors, starting with Dr. Chen, if you could tell our listeners how your two specialties work together.
So cancer is a multidisciplinary field of medicine. It just doesn't involve one doctor. It just doesn't involve the radiation oncologist or medical oncologist or the surgeon. It involves a team. It's a team effort. And so in the case of breast cancer, a lot of times Dr. Bushkin will be the first person to diagnose the disease. After the disease is diagnosed, then he will go ahead and frequently get together with the consult with the radiation oncologist, consult with the medical oncologist, and together we'll put our heads together and determine what is the best plan of care, what's the best plan of attack to beat this cancer. And sometimes it involves doing chemotherapy up front, or sometimes it involves doing the surgery up front, followed by chemotherapy or followed by radiation therapy. And we really need everybody's input to be able to deliver the best care possible for the patients, and also respect the patient's desires for path for their course of treatment as well.
Mm-hmm.
All right. Bushkin, Dr. Bushkin, did you want to add anything?
Yes, thank you. Yeah, Dr. Chen and I have worked together for decades, he and his colleagues, and all the people we work with, breast medical oncology, radiation oncology, the genetic specialists, and the plastic surgeons that do breast cancer reconstruction are trained in that type of surgery. So it's not any plastic surgeon does breast surgery. It's specialty trained plastic surgeons. But we all have a very, very good feel for each other's specialty. And we talk about the patient before they see the specialist, after they see it, and the notes are very, very scientific notes. And we have a very good feel doing this on a daily basis, year in, year out, of what's best for the patient. But there are options and judgment to be made. But as Dr. Chen said, we all communicate and make sure the patient and their family are very well informed.
That's great. So how, if you can describe a scenario in which you all have worked with Trilogy Home Healthcare, our show sponsor, together, and then see, paint a picture for our listeners.
Well, I think it may be more my specialty, I would think, than Dr. Chen's, because of the post-operative situation. And home health care, not only for breast post-operative care, but for all the other specialties post-operative, but obviously home health care is much more than post-op care. And we've had some changes in surgery the last decade that have changed things somewhat. One is called ERAS, which is Enhanced Recovery After Surgery, where there's a protocol, which is important. I'm sure that's part of what Trilogy does. Mm-hmm. And then the other thing is that when we do either a unilateral or a bilateral mastectomy, the anesthesiologist, using ultrasound guidance, now does pectoralis major and minor blocks. So those are the muscles that remain after mastectomies, and the woman is pain-free for up to 48 hours. Even that being said, the need for pain medication after mastectomy is minimal, and all the patients go home. But where home health comes into play is there's drains in place, wound care, ambulation, care of the woman at home, making sure they get the medicines. So the care is much more than the operation.
Yeah, if I can add just something real quick, like my mom just went through breast cancer a few years ago, so I did see this type of collaboration and action where the breast cancer, when she was diagnosed in the very beginning, and later on, she had her surgery to remove it, and then the radiation, the chemotherapy, then came the radiation. It was a very long process, but communication is so key, which is what they're mentioning right now. The way that Trilogy can help is when they are at home, we can help with that wound care, and we can help with the pain, like he's saying, with ambulation and all those other things. And we're like a second pair of eyes when the doctors are not there. Like, there's also a great communication with Trilogy and with the physicians to keep them in the loop of how their patient is doing, if they're doing better, if they need to be seen maybe sooner than the date that they have an appointment. So, it's a collaboration on all parts. So it's an extension of 21st century oncology.
I would just like to add that surgery and radiation are two very critical components of the patient's treatment. However, there are elements that we don't provide of patient's care, including home nursing, physical therapy, occupational therapy, nutritional support, that Trilogy is really able to help patients out with. And this is very important in the recovery process.
I agree with that. And you made a very important point. I see the women several times the first week, and if it's a plastic surgeon, they see them the same several times the first week. But having another trained person, a trained nurse, to see the patient on a daily basis or whatever the schedule is extremely important, and we appreciate it very much.
Thank you all for that. Now, finally, how can someone get a hold of you, starting with Dr. Chen?
Our office phone number is 954. This is for radiation, 954-392-4750. That's 954-392-4750. Or you can search for us on the web, www.21co.com. Again, www.21co.com.
Yeah, that's the same for me. Presently, it's 21st Century Oncology. In the coming months, soon to be Genesis Care. It'll have a new website, a very sophisticated website. My office number, two offices, one in South Broward, the Hollywood area, and one in the Coral Springs area, see patients from the Tri-County area and Central South America, the Caribbean. We all see patients in a wide geographic area. My phone number, Frederick Bushkin, is 954-985-9336.
Wonderful. Liza?
Well, for Trilogy Home Care, I can personally take care of any patient that is interested in extending the care to the home. My phone number is 305-794-4241.
I would love to thank you all for joining us this evening. Again, we've had Dr. Christopher Chen, radiation oncologist, and Dr. Frederick Bushkin, by surgical oncologists from 21st Century Oncology, soon giving Genesis Care. Thank you, Liza May. Have a good night.
Bye. Thank you. Thank you, Dr. Chen. And thank you, Dr. Bushkin.
Thank you very much.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers